Aloha. Welcome to the Sports Medicine Clinic. My name is Dr. Joshua Peiper, and today I will be demonstrating the self-myofascial release and muscle energy techniques for the sternocleidomastoid, or SCM, and the anterior and middle scalene. For today's techniques, all you need is your thumb and a flat surface to lie down on. To achieve the self-myofascial release component of these techniques, we are going to apply continuous force or loading into the fascia in the area of the SCM and the anterior and middle scalene for 1 to 2 minutes. To achieve the ischemic compression component of these techniques, we are going to locate tender spots and then apply continuous pressure to the tender spots for 20 to 30 seconds or until the discomfort or tenderness has decreased, at which point we're going to move on and treat other tender spots within that muscle. It is important to note that the area that we're working in, the anterior cervical area, has arteries, nerves, and veins. So if you feel a throbbing, the pulse from an artery with your contact of your thumb, you're going to want to move that contact backward or posterior until you no longer feel the throbbing sensation, which means that you're no longer on the artery. Also, in between the anterior and middle scalenes is a triangle. In that triangle passes a structure which is a bundle of nerves called the brachial plexus. So you're going to want to avoid the area in between the anterior and the middle scalene. The SCM is a muscle that attaches to the mastoid, which is this bony section of the head just behind the ear. It runs down or inferior, attaching to the top part of the sternum and the middle portion of the clavicle or collarbone. The anterior scalene attaches near the transverse processes of the cervical vertebrae and is going to run just behind the SCM, down and inferior, attaching to the first rib, which is just beneath the clavicle. The middle scalene also attaches near the transverse processes of the cervical vertebrae. It is also going to run down and inferior and attach to the first rib just behind the anterior scalene. As you can see here, right, the thicker muscle here that runs from the mastoid down towards the clavicle and the sternum, right, is the SCM. What you can't see so well is the anterior scalene, right, which is going to attach up here and then run inferior and down, attaching to the first rib, right? So posterior to that, if you cross the triangle where I said the brachial plexus would be, is the medial scalene, right? And here the medial scalene will run down and inferior, also attaching to that first rib. So when these muscles are dysfunctional, they'll lead to or contribute to a forward head posture. The anterior and middle scalene, when dysfunctional, can contribute to compression of the brachial plexus and leads to thoracic outlet syndrome, which is a numbness, tingling, burning sensation that runs from the neck, down the shoulder, down the arm, and into the hand. The anterior and middle scalene can also lead to indirect compression of the brachial plexus, as it can pull up on the first rib, which will compress the brachial plexus between the first rib and the clavicle or the collarbone. This will also cause thoracic outlet syndrome. When performing these techniques, we're just going to use the padded part of the thumb, and we're going to start at or near the mastoid, where if you put your finger here and you run it laterally or side to side, you can feel taut muscle fibers. So what we're going to do is we're going to start with gliding strokes, and we are going to follow the muscle inferior 6 times, just to warm the muscle up. As we are performing the gliding strokes, we're going to take note of any tender areas so that we can treat them later. Once we've completed at least 6 gliding strokes, what we're going to do is we're going to stop on the tender areas that we located when we were first performing the gliding strokes. So now we're going to hold these tender areas for 20 to 30 seconds or until the discomfort ceases or becomes less. right? So I'm going to try to find another tender area in the muscle. And again, we're going to hold that for 20 or 30 seconds. So as we're tracing the two anterior or forward muscles, the SCM and the anterior scalene, we can treat those together. Once we've treated those, we're going to move posterior to the middle scalene and try to find trigger points within the middle scalene as we're performing gliding strokes again. Once we've performed 6 to 8 gliding strokes, I'm going to locate the tender areas and apply compression to the tender areas for 20 to 30 seconds or until the tenderness decreases. And then I'm going to look for another tender area. Again, very important to note when you're performing this, if you feel the pulse, that you want to move your finger posterior or backward until you can no longer feel that pulse. Also, when performing the technique for the SCM, you can use a pincer compression. So again, if you turn your head away from the side that you wanted to treat, right, you can expose the SCM or the muscle that you want to treat and apply a pincer compression in between the thumb and the knuckle of the index finger. Once you've located the muscle, you want to turn the head back to neutral so that the SCM or the muscle you're working on can have some slack. That way it's easier to pinch while you're looking for those tender points. If you find those tender points, you can compress them in between your finger and your knuckle until the tenderness decreases. I'm going to reach down towards the feet with the hand on the same side that we're treating. In this case, I'm going to use the kettlebell so that I can pull the shoulder down towards the feet and start the stretching mechanism for the SCM and the anterior and middle scalene. This is an optional step, but you do need to reach towards the feet to help create that stretching mechanism. Then I'm going to look away from the side that we're treating to finish that stretching mechanism. I'm going to hold that barrier for 20 to 30 seconds while pushing the sternum towards the feet. This is going to help increase the stretch. After 20 to 30 seconds has elapsed, I'm going to use the free hand to provide resistance as I try to return the head to neutral using 15% or less of my strength. I'm going to hold this contraction for 5 to 10 seconds. I'm going to release and relax for a second, and then I'm going to push the sternum towards the feet again to increase the stretch to the next barrier. I'm going to hold this new stretch barrier for 10 to 20 seconds. Once that time has elapsed, again, I'm going to perform the isometric contraction by blocking the head off and trying to return it to neutral position for 5 seconds. I'm going to relax and increase the stretch by pushing the sternum towards the feet. I'm going to complete this cycle 3 to 4 times